The past few months have been a whirlwind of activity at Australia for Cedar Tanzania. We are thrilled to share that no fewer than 5 new projects are launching between March and June. They are all designed to bring sustainable change and improve health and well-being in our communities. Here's a look at some of our newest initiatives. First, we have a new project called Smile. Smile is bringing pre- and postnatal care to women in their own homes. Pregnancy and childbirth should be a time of joy, but for many women in rural Tanzania, accessing essential healthcare remains a challenge. While expectant mothers are entitled to 4 antenatal visits, research shows that attendance rates are low due to barriers such as distance, cost, and lack of awareness. In response, we are launching Smile, a project that delivers pre- and postnatal care directly to women in their homes. Postnatal care is equally crucial, as both mother and baby face heightened risk in the early weeks following birth. According to the World Health Organization, nearly 50% of postnatal maternal deaths occur within the first 24 hours after childbirth, and timely postnatal visits can reduce neonatal mortality by up to 27%. Recognizing this gap, Smile extends support beyond delivery, ensuring that both mother and baby receive essential health checkups and guidance during this critical period. The project officially launched in April with a dedicated nurse leading the initiative. Over the past 2 weeks, he has undergone intensive training, including off-road motorbike riding, an essential skill for reaching remote areas. As we monitor the impact of Smile, we are hopeful that this initiative will expand over time, reaching even more mothers and babies in need. We are eager to see Smile make a real difference in maternal and infant health. Our second new project is about computer literacy. Technology is a powerful tool for education and economic empowerment, yet many people in our community have never had the opportunity to learn basic digital skills. To change this, we are launching computer literacy classes at our community center in April. Thanks to recent investments in securing a dedicated space for our computers, we can now safely store our equipment and offer structured classes. Participants will learn essential skills such as conducting internet searches, using Microsoft Word and Excel, and leveraging technology to improve literacy and numeracy skills. This initiative is particularly exciting because you can help. If you have an unused desktop, laptop, or tablet, we would love to put it to good use. Your contribution could make a world of difference for someone taking their first step into the digital world. If you have a device to donate, please let us know in the comments and we will reach out to you. Another new project is mental health training for our outreach team. Our outreach team works closely with community members facing a range of challenges, including those struggling with mental health issues. Navigating these cases requires sensitivity, knowledge, and emotional resilience. That's why we are delighted to announce that 2 of our team members, Jackie and Stephen, have been selected to take part in a 12-month psychology course. This program, attended by representatives from 5 other local NGOs, will cover essential topics. For example, psychological self-care for frontline workers, psychological first aid techniques for supporting clients, and strategies for handling trauma and crisis situations. Once trained, Jackie and Stephen will share their knowledge with the rest of the team so that the entire outreach team is better equipped to provide compassionate and effective support to those in need. We are also thrilled to announce our plans for a new 26-bed maternity ward. It's an extension to our current hospital. Construction will begin in July this year and be completed in the first half of 2026. This expansion will greatly enhance our ability to provide maternal health care to the community. However, before the first brick is laid, a tremendous amount of groundwork needs to be done. For example, we need to do architectural drawings and design, we need budget planning and fundraising, permits and regulatory approvals, contractor selection and site preparation. This is a monumental step in ensuring safe childbirth for women in our region. This ward will also have facilities to perform cesarean sections and provide safer assistance in cases of complications. We will keep you updated on our progress. Are you up for a fundraising adventure? Then this new project is for you. For those seeking a challenge with purpose, we are in the early stages of planning a Mount Kilimanjaro climb as a fundraising initiative. More details will be shared soon, but if you have ever dreamt of summiting Africa's highest peak while supporting a great cause, keep an eye out for updates. While we continuously plan and develop new projects, we also manage our established and ongoing projects, such as our outreach team that provides essential medical care to people with disabilities in their own homes. We currently have approximately 350 families on our schedule, all of whom receive at least one visit per week, some many more, depending on their individual needs. Our occasional Our occupational therapy and physiotherapy clinics are open for business twice a week, providing essential rehabilitation services for individuals with disabilities and mobility challenges. Our dedicated team works closely with patients to improve their independence, mobility, and overall quality of life through tailored therapy sessions. Our hospital they serve 30,000 residents, providing maternity services, vaccinations, under 5 health checks, HIV/AIDS counseling, and ARV distribution, general medical care, and overnight observations when necessary. We also have 6 savings clubs, where groups of up to 20 people meet regularly to save money and access small loans to improve their financial security. Savings groups are a powerful tool for economic empowerment, helping members build resilience and invest in their futures. Our tailoring project continues to thrive. The first group of 2025 have just graduated, equipping participants with valuable skills for employment and entrepreneurship. We also finishing our landscaping and water drainage improvements following our new perimeter walls completion, ensuring that our facilities sustainability and safety. As if all of this wasn't enough, we are currently negotiating for another 3 projects, which we hope to announce soon. In addition, we have several grant applications under review, and we will be submitting 2 more this month. We couldn't be more excited about these new initiatives, and we are deeply grateful to everyone who has made them possible, whether through donating technology, spreading the word, or supporting us financially. Every contribution helps drive positive change. Stay tuned for more updates as these projects unfold. Together, we are making a tangible impact. Thank you.